Welcome to SheTV.com, where board-certified physicians talk to you about women's health. In this video, the doctors talk to you about heavy periods.
Hello, this is Dr. Dana Bach. I am a board-certified anesthesiologist. I practice in Oklahoma City at Lakeside Women's Hospital. I have joining me today a friend and colleague. This is Dr. Armstrong. He is a board-certified OB-GYN. We wanted to visit today. Well, he wants to tell you about it. I'm just going to ask questions about heavy periods. Dr. Armstrong, tell me what is a heavy period, first by definition, and what does it mean?
Absolutely. So very common reason for patients to come in and see an OB-GYN is to discuss, hey, my periods are very heavy. And I think one of the best things to tell patients is, first and foremost, what defines a heavy period is just you as the patient. If you think it's heavy, it's heavy. If you think it's abnormal, it's abnormal. And I also think that one of the greatest things to tell patients is that there are many, many options available to help to manage your heavy periods. You don't have to deal with that. Some patients, unfortunately, their periods are so heavy that they develop significant anemia and require transfusions. But there are things that can be done to help prevent that. So just know that a heavy period is whatever you think it is. If you think it's heavy and abnormal as a patient, it's heavy, it's abnormal. If you think that something needs to be done about it, we would love to talk to you about it and see what happens. Heavy periods are normally created just by one of the most common reasons. The lining of your endometrium every month thickens, preparing for a possible fertilized egg. And then every month when you don't get pregnant, your body says, all right, let's reset. And the lining inside your uterus thins out, and that's where your period comes from. So when we talk about treatment options for heavy periods, one of the first things we talk about is a form of birth control. And honestly, we use the word birth control, but really what we should call it is period control, because that's what we're really doing. We are trying to control your period, first and foremost, so that you do not create an egg, you don't ovulate. And if you do not create an egg, then you can't get pregnant. But second of all, we're trying to control that lining of your uterus, that inside part of your uterus, the endometrium I mentioned, and to keep it nice and thin. When it's thin, then when it's time for you to have your period, you don't bleed as much. There's not as much there. But for those patients that have a thickened endometrium and have heavy, even painful periods, sometimes from heavy periods, one of the first line treatment options is getting on some form of birth control / period control to help to thin that lining out and to reduce your total blood loss.
Okay, that makes perfect sense.
Yeah.
So someone with a heavy period would schedule an appointment with you or another OB-GYN, come in and see you, explain to you the periods, and then you would prescribe a medication at that point, and they would start it immediately. Is there a time frame?
At some point, we would start treatment, but sometimes we have to do a little bit of investigation as well, too. So normally if they came in and we talk about heavy periods, we're going to do a physical exam. There is some blood work that we look at because sometimes your thyroid can cause heavy periods. So if your thyroid's off, we're going to evaluate, make sure we don't have any anemia to take care of initially. Those patients that are really anemic, we've got to concentrate on that first. And then a lot of times we'll order up an ultrasound, a pelvic ultrasound to look at your uterus, look at your ovaries. We're looking at the structure of the uterus to see what that lining looks like, how thick or how thin it is. If there's anything in the lining that could be abnormal causing bleeding, such as endometrial polyps, or for some patients that will develop fibroids, which are benign small masses that can develop within the uterus and can cause abnormal bleeding as well too. We need to do a little bit of a workup first to give you the best direction and treatment options. And so that would be the initial workup. Talk to you about your symptoms, physical exam, and then a little bit of laboratory or imaging workup as well too. And that's where I feel like patients have had the best plan going forward. So.
Perfect. That sounds good. And then the patient would see you again, go over all those results, and come up with a plan that will work for them.
Exactly. Utilizing birth control is one of the most common ways that we treat that, especially, let's say, if we do the exam, we do the blood work, imaging looks great. Yeah, that's one of our initial steps, is looking at some form of birth control to help to regulate your periods and to decrease that bleeding. If there are other abnormalities that we see on the imaging, we're going to address those in an appropriate way. And sometimes that requires surgical intervention. Sometimes that requires other forms of hormone medication that are not quite birth control, but could help to kind of control your bleeding in a different direction, mainly associated with large fibroids.
Okay, perfect. So, a time frame for that patient, maybe within a couple of months, you've got them back on the road to recovery. And
even hopefully sometimes less than that. Normally, the initial workup takes, a few days to a week or so to kind of see, and then we can kind of get an action plan going forward on when to see that transition. And normally, yes, within 1 to 2 months, they're doing better. They're doing great. And getting their cycles to where they want it to be, right? Where the bleeding's less, and if those patients are anemic, if they're starting to recoup their anemia and they're feeling better from not being as anemic. So, but yeah.
Perfect. That sounds like a great plan going forward.
Yeah, a lot of great options out there.
Okay. Right. So really, the best part is to get in to see their OB-GYN soon. Don't put it off, and get a treatment plan going after the workup, and they're going to be feeling better soon.
Exactly. There's the great thing now is that we have multiple options to help treat the heavy periods. And so for those patients that maybe have tried something in the past too and didn't feel like they had great success, please don't give up on your health. There are still multiple options that are out there that are different than probably what you've tried in the past. And I encourage you to come in and talk to your physician about that. Come talk to us about your symptoms, talk to us about your past, and we can definitely get you on to the road to where you want to be. Okay. My goal is, as I tell patients, when you're happy, I'm happy. It's what we're after. So
perfect. Well, thank you today for joining us and talking to us about heavy periods, and what we can do to get rid of those.
Absolutely.
No one wants to live with it.
No, you don't have to. So thank you for your time.
You bet. Have a good one. Bye-bye.
Thank you for watching SheTV.com, where board-certified physicians talk to you about women's health. Please contact us at SheTV.com if you have comments or a particular subject you would like us to address.